Thank you, Mr. Chairman. Let me just continue on that for just a moment. You said that the Ryan plan would define the end of Medicare as we know it. Why does the IPAB not provide a similar definition?
Well, I think, Congressman, the Independent Payment Advisory Board makes recommendations to Congress. It is forbidden by law to do exactly what the Republican budget plans.
Let me ask you a question.
They may not shift costs to seniors. They may not change benefits.
As we know from reading the law, it's very, very difficult for people to appeal those decisions. And in fact, we won't even know because no one currently has standing until there's actually implementation of the board, which has not happened yet, and care is denied, and they take it through the courts. But I think we're going to find it's very, very difficult to overturn a decision of this board. Can you tell us the difference between a voucher and premium support?
The difference between a voucher and premium support?
Mr. Ryan's articulated aspirational document in the Republican budget talked about premium support, concept actually introduced during the Clinton administration with the Commission to Save Medicare, the Bro-Frist Commission. On the other side, the talking point is that he's going to give a voucher.
A voucher is basically, I think, insurance terms, a guaranteed contribution, as opposed to a guaranteed benefit. Those are very different concepts. On one hand, in the current Medicare program, seniors and those with disabilities have guaranteed benefits. That which switch, it's a voucher.
And then what would premium support look like in that world?
Pardon me?
What would premium support look like?
I'm not as familiar with that term. I know what guaranteed contribution is. I know what a voucher is. So
it's incorrect to use the terms interchangeably, as so often happens in this committee. Premium support is a different phenomenon than a voucher. Premium support would be a request for proposals going out to insurance companies to provide the coverage, much as in Medicare Part D's, so you should have some familiarity with it.
Well, if you're assuming, Congressman, let me just ask, if you're assuming that $8,000 provides the total benefit.
This is my brief time to be able to ask you questions, right. So I've got to insist upon that. Now, the budget for the Independent Payment Advisory Board begins October 1st, correct? $15 million?
It is available, yes, sir.
Now, who has been nominated to that board and is awaiting confirmation?
No one.
And why is that?
Well, I think, Congressman, the board is not activated until 2014. And I know that the President is in discussion with a number of potential nominees, and I know he has consulted with various members of Congress, but it will be appointed and up and running at the time.
So can we keep that $15 million that is due October 1st? Because you apparently don't need it to set up the board because...
We have no intention of using money before there is a board up and running.
Well, who does the check go to?
I don't think there is a check. I think there is money available that we would draw down. It is a...
Can we have that money back? We're in a debt crisis. You may have heard.
I understand. I can assure you there will be no drawdown on the Treasury of $15 million until there is a board and a functioning operation.
Now, on this board, are they available to be a recess appointment by the President so that they would not be subject to Senate confirmation like your head of CMS is?
I am not a lawyer. I can't answer that question. I have...
Well, the CRS report that's available on this indicates that there would be the availability of a recess appointment. I count 9 that wouldn't require input from either the Speaker of the House or the Minority Leader on the Senate side. So 9 would be a majority, but in fact you don't even need a numbers majority. You just need a majority of those who've been appointed. Is that correct?
That's correct.
Let me ask you this. It looks like in statute that you could not have a majority of the board made up as physicians. Is that correct?
My understanding is that the prohibition is, yes, that a majority could not be practicing physicians.
Well, who can make up the majority? I mean, the definition of who can be the members is actually a little bit vague. It's peoples with a national recognition for their expertise in health finance. That's an odd pool, but they can actually make up the majority?
Well, I think, Congressman, that
So think tanks can be the majority of this board?
The characteristics of the board members are modeled after the characteristics that were defined for the MedPAC board members, which have very similar kinds of backgrounds and abilities. The very significant difference is that there is a very strong conflict of interest barrier for the IPAB, where they could not be receiving payment from the system and making recommendations at the same time.
The man who would have been your predecessor, but he actually didn't get confirmed, Tom Daschle, wrote a book called Critical. I don't recommend anyone buy it, but he talks about this board. This board was something that he extolled in this book to a great degree, but it was actually patterned more after the Federal Employee Health Benefits Program, which is in fact employer-sponsored insurance. Is it your vision that one day this board can be spread to further than just the Medicare world, but could actually control the private health insurance world, much as the Center for Consumer Information Insurance Oversight now envisions controlling the private insurance market as well?
Again, Congressman, the board doesn't control anything. They make recommendations to Congress in the event that Congress has not acted to keep Medicare solvent. That's a recommendation board. They don't control the Medicare program. Congress is in the driver's seat. They make recommendations, and I think that could be very helpful as we look for ways to preserve beneficiaries' right to health insurance and look for a program to be solvent on into the future.
Regular order, Mr. Chairman.